My name is Dr. Yaman Sağlam. I'm the medical geneticist of Medical Hospital Group. This is the first genetics lab in the hospital group. There are nearly 30 hospitals in the chain, and we are the genetics center. There are many genetic disorders that we can perform in our laboratory. Especially we are working on cancer genetics, infertility genetics, some genetic disorders for pediatric problems, and we can, beyond this, we can do some specific treatments for selecting healthy babies in our laboratory, because thalassemia is one of the important disorder in Turkey. There are many affected people from thalassemia, so we can select healthy non-thalassemia babies to prevent families to avoid. We can perform cancer studies to diagnose cancer or in the treatment of cancer. This is a very useful test for treatment. Which treatment is better? We can use some genetic tests to do this. For instance, preventive medicine side, there are some genetic tests. For instance, we can see in the future if a person has diabetes or not, or he's in a risk or not, or some further treatments like obesity, hypertension, and some familial risks we can analyze by genetic tests. This is one of the leading genetic laboratory in the Turkey. Especially in pregnant women who want to know about the risk of their fetuses, if there's a risk or not, they need genetic tests. And in the early period of pregnancy, we can take some sample from fetus or the fluid which the fetus was inside, and we can analyze genetic, if there's a genetic problem or not, with genetic tests. These are very special. If in the family history, if we know about the risk of genetic risk of the family, we can select the healthy baby and we can avoid the family from this disorder. This is pre-implantation genetic diagnosis, selecting healthy babies. But for Down syndrome, it is not inherited from mother or father. It becomes in the child. It's a different kind of disease. So we can detect Down syndrome risk in the pregnancy. But sometimes we can even select for Down syndrome healthy babies in the embryo period. If there's a normal embryo, we give it to mother, and mother be pregnant to healthy embryo, non-Down syndrome baby. You mean the test success is high because we are working on molecular diagnostics, and there are some really minimal risks on diagnosis. The risk should be depending on the methods. We couldn't do the diagnosis according to the disease's conditions. It's sometimes very hard to get the test results. In this time, we are continuing the study for further molecular diagnostic techniques like next generation sequencing. These are very newly in the market, and we can also perform that kind of tests. So we have to find the exact results for the genetic disorders. We are successful on this. Yeah, there are new approach for this test. Amniocentesis is an invasive technique. This means that we get the amnion fluid from the mother. Now we have a new technique. We just get blood from the mother, and the fetal DNA in the mother's blood can be analyzed by new technique. So very soon we are performing just getting blood of mother. We don't take amnion fluid from the mother. This is new. The first we have a sample collecting place, and we first separate samples according to need. For instance, will we do a molecular test or cytogenetic test? We separate sample and we enter to database and assign all the samples with a specific way. Then we pass insights. We start to work in our laboratories. There are two sub-laboratories in the center. One is molecular laboratory, one is fish laboratory, the other is cytogenetics laboratory, and we can use this for pre-implantation genetic diagnosis also, these three. And according to our needs, the test starts, and in some ways the test continues up to 15 days, but in some tests it goes 5-7 days period. At the end, the results were controlled by me, then reports become.